Hi, Dr. Kimberley Wilson here from Inspire Physical Therapy, and I would like to talk to you a little bit today about the practice of deep squatting. Let's talk about maybe a series of how we might progress if we find this activity difficult. So I want to walk you through some of those strategies, but I also want to talk to you about what are some of the health benefits from practicing this very functional movement and maybe some of the potential negatives if we're not practicing deep squatting. So let's get started.
So here we have a very basic squatting, a sit to stand. So it's a very modified squat, but it's a place to start if it's something that you're having difficulty with. And if we don't practice squatting, we're going to lose that ability to squat. And that's our normal strategy for sitting down. So this is a great starting exercise if you're trying to get to the point where you can do some deep squatting. Losing the ability to squat changes the way that we breathe, and it really limits our ability to perform that all-important diaphragmatic breathing. So you can see here I'm taking just a moment while I'm in that modified squat to check in with my ribs, make sure that I'm breathing into that space. Because when we breathe into our chest, which happens if we lose this ability for squatting, we're using our accessory breathing muscles instead of the diaphragm. And our diaphragm happens to be our primary breathing muscle. So you're going to see through a series of these progressions how I'm starting kind of at a low level and then progressively working into a harder position to do the deep squat. Why should we even care about our squatting or our diaphragmatic breathing? Well, one of the reasons is that all of the organs in the abdomen depend on the diaphragm for movement. So when we're tapping into that diaphragm to breathe, we're helping to move all of the organs within our abdominal cavity. So our small intestines, our liver, our large intestines, our kidneys, our uterus, our ovaries, and they really depend on that diaphragm because they can't move on their own. So this movement then is going to help to support increased blood flow, increased or improved lymph drainage, and then ultimately overall improved health. It also supports our autonomic nervous system. So if you're not familiar with that, that's your fight or flight versus rest and digest. Without the diaphragm moving, you're not going to get healthy vagus nerve tone. The vagus nerve is that all-important wandering nerve that does so many things throughout your body. And being able to tap into that's going to help you to remain much calmer and be able to handle those day-to-day stressors. So when you squat, you decrease the body's ability to breathe through those upper chest and the shoulders. You're actually taking that away. So it's going to force you to breathe into your diaphragm. You're going to breathe, right? So it's going to force you into a position that's more optimal for diaphragmatic breathing. It's going to increase rib mobility, and then it's going to force more breath or more air into your abdomen. So many benefits. It's going to improve your digestion. It's going to support a rest and digest autonomic nervous system state. It's going to improve anxiety. It's going to improve stress. It's going to support issues of constipation. If you can get your large intestines, if they can have that gentle massage that comes from diaphragmatic breathing, they're going to function so much better. Diaphragmatic breathing has also been shown to support things like autoimmune disease and being able to manage that so much better. So give these series, if you're having trouble with deep squatting, give these series of progressions a try. Meet your body where it's at and just start somewhere. And don't forget to incorporate some breathing. Take one step at a time and do 5 deep breaths with each position. And really tap into that diaphragm. Visualize the diaphragm moving. One of the visual cues that I use a lot in my practice is as you inhale, visualize the air filling up the abdominal cavity as if you're pouring water into a glass, meaning the water is going to fill up the bottom of the glass first and work its way up. So you want to think about as you inhale that you're bringing air into the bottom of your abdomen or even the pelvic floor, and then the middle of your abdomen, and then the top part of your abdomen as you expand the lower part of your ribs. The exhale is a similar visual. So as you exhale, you visualize the air leaving the bottom, so the pelvic floor, the lower abdominal. Then it leaves the middle abdomen, and then finally leaving the upper abdomen around the bottom part of your ribs. Exhales can really be a sweet sauce, quote unquote sweet sauce, for improving your breath. So making sure that you completely exhale prior to that next inhale. And again, I always recommend starting with a low repetition when it comes to diaphragmatic breathing. So something like 5 to 6 reps or 5 to 6 deep breaths. And then move on and practice them again the following day. But with some good consistency, you'll start to see improvements. So I hope you able to take away some good tips from this video, and I would encourage you to start squatting if you're not already doing it, and to incorporate your breath work into those positions. I hope you have a great day and happy squatting.